At both Tendring and Colchester councils, we understand that good health starts at home. Everyone, regardless of age or background, should have the opportunity to live in a home that is suitable for them and their family's needs, and is safe and free from hazards and serious defects. As part of Livewell, the councils are keen to promote the role housing plays in everyday health. The council's private sector housing teams are here to help those who live in shared housing, rent from a private or social landlord, or who own their own home. We can help with a range of unsafe living conditions, including cold and damp homes, unsafe electrical installations, as well as unsafe stairs and steps. Here is an example of how the councils can help. Joan is 83 and lives alone. She owns her home and relies on her basic pension to get by. Joan struggles with the stairs, and with the bathroom being upstairs, sometimes finds it difficult to manage. There are only old gas fires to heat the house, meaning it can get very cold in the winter months. Last winter, Joan had a chesty cough that wouldn't go away, so she booked to see her GP, who prescribed some medication. He also took a look at her feet, as one was very sore, and he arranged for a health professional to visit her to apply some dressings over the course of the following week. The health professional visited, and as part of the visit, undertook an assessment of Joan's home. She noted the poor heating, and because Joan was finding it difficult to get up and down the stairs, she made a referral to an occupational therapist at Essex County Council. Back at the office, she completed a form and emailed it off to the private sector housing team at Joan's local council, asking them to contact Joan. An officer from the local council contacted Joan and arranged to visit her, as it sounded as though they may be able to help. After a full inspection of the house, the officer completed a risk assessment and identified a serious hazard that may affect her health and safety, and because of this, they had to do something about it. As she owned her home and was on a low income, she met the criteria for discretionary financial assistance from the local council, which would cover the cost of a new boiler and central heating system. The officer also discovered some rotten windows, and the roof had a slight leak, and these were things that could be covered by the loan too. After talking to her daughter, who now lives in Canada, Joan agreed to go ahead and applied for a loan, and the council made arrangements to help her fill out the forms and talk to builders. It wasn't long before the occupational therapist came to assess Joan and recommended that she have a stair lift and a more accessible shower. This is so that she could get upstairs and wash in greater safety. The recommendation came into the council, who were able to offer a disabled facilities grant in addition to the loan, which could be used to pay for the adaptations. Joan was eligible for the grant due to her financial circumstances. The council arranged support to help her with this application. In addition, the council identified what other financial help Joan may qualify for and supported her to apply for it. The work to Joan's home is now complete, and it is now a much safer place for her to live in, and she feels more able to carry out day-to-day tasks with greater independence. Joan also feels much warmer in winter. The councils are working together with a range of health and social care partners and community organisations. Without this collaboration, Joan would have been at risk of a fall or a cold-related illness. Imagine if she had fallen down the stairs and broken her hip. She would have faced weeks in hospital and respite care, and in all likelihood may not have been able to return to her home. This would have caused Joan greater distress and would have cost the NHS and wider society more than the cost of the works carried out in her home. Imagine that Joan had been renting a house from a private landlord. Rather than offer Joan a loan to carry out the heating, window and roof repairs, the council would have contacted her landlord and asked them to carry out the work. Had the landlord not done so, then the council has enforcement powers that would have required the landlord to take action. A disabled facilities grant to fit the stair lift and improve the bathroom can be offered to someone in privately rented housing, providing the landlord agrees to the works. Tendring and Colchester councils are keen to help more people living in unsafe living conditions, because ultimately it leads to safer, happier and healthier communities. If you, or anyone you know or support, would benefit from our help, please get in touch. Alternatively, if you are part of an organisation that supports residents and you don't currently work with us, please contact us so we can see how we can work together to help the residents of Tendring and Colchester.